Welcome back to Access Houston on 97.9 The Box.
Good Sunday morning. You're listening to Access Houston. I'm your host, KG Smooth. Welcoming some first-timers in the studio this morning. It's all good. You can breathe and relax. You know, I'm family, but you're about to find out. Welcoming from the Kappa Alpha Psi Fraternity chapter, the Houston alumni chapter of Kappa Alpha Psi Fraternity, Mr. Ron Lockett. Good morning, sir.
How you doing? Thank you.
And Dr. Kelly Kinney. Good morning. Kearney. Kearney. I'm sorry. Kearney. It's been a busy morning. It's early. Dr. Kearney, okay. Mr. Lockett, welcome.
Thank you.
You all are doing something that is very important for people, period. And that is spotlighting mental health. And so there's a mental health symposium that is happening at U of H. Tell us about the Mental Health Symposium.
Okay. Well, definitely Saturday, November 18th from 11 a.m. to 2, we're having a mental health symposium. And the focus of it is to really understand and make sure we bring awareness to mental health issues in our community. I mean, we have a lot of issues, a lot of different aspects of mental health. And typically our community, we're really afraid to talk about it. We want to be very quiet about it or kind of ignore the symptoms or ignore people we know in our family with it, but we want to talk about it, bring awareness to it. So the organization, we've brought together a lot of mental health specialists, some doctors. We're going to have seminars, and we're going to really bring awareness to it, and hopefully the community can come out and get a lot of information about mental health itself.
Indeed. Dr. Kearney, tell us about your involvement with this.
Yes, I will be one of the speakers at the Mental Health Symposium. And one thing I really want to focus in on is mental health in the Black community. Individuals and my patients and students and other people, they tend to shy away from talking about the important topic of mental health. In the Black community, we tend to use prayer, we go to church, we use our support systems, and all of those things are very, very important. But what I find is that we shy away from seeking professional help. So I just want to bring awareness into discussing topics like major depression disorder, suicide, post-traumatic stress disorder, which are all very prevalent in the Black community, and just what can we do to get more individuals to seek professional help and stop being afraid of stigma.
Yeah, and I think that's what it is. It's a stigma. I always relates back when people talk about, certain things that we do or don't do as Black people. I'm like, it all goes back to slavery. I don't care what. Everything reverts back to the origin of, how and when we got here and how we were treated. So that stigma does need to be broken because they think it's wrong. A lot of Black folks think that it's wrong to sit on someone's couch and to talk your feelings out. It's just like, oh, I don't want to sit and, tell a stranger my entire business. Okay, but yet you posting it all on Facebook and you're getting advice from people who have no idea how to even navigate life, much less give you advice on said issue that you're going through. So it's just like, what is it really? Right. You know what I'm saying? Like, why do you think that is?
I think that individuals in our community see mental illness as a personal weakness, especially Black women. Black women are strong, tend to carry everything and everyone else. Yeah. So we're not as likely to seek help because we're like, okay, we can get through this. We'll overcome it. And that's it.
That is something else. You're listening to Access Houston. We're talking to Dr. Kearney and Ron Lockett. They're having the Health Mental Symposium, which is happening on Saturday, the 18th at U of H. When Harvey happened, I was home in Ohio. I missed the hurricane because I flew home. My brothers threw a fight party for the Mayweather-McGregor fight.
Okay.
And so what was supposed to be like just a weekend, little quick trip ended up being 9 days because I couldn't get back because of the devastation in Harvey. But when I was back home in Dayton, Ohio, watching all of the news footage throughout the different cable news channels, I was watching CNN, and they were talking to a young lady who was down at George R. Brown.
Okay.
and she was telling how her and her family had got out and how this is her second time going through this because she moved here to Houston from New Orleans because of Katrina.
Oh, wow.
Yeah.
And so as she's telling this story, she was like, this is my second time going through this, and I'm glad my sons and my kids are okay, but this is too much. Like, I'm going to need some help. Like, mentally, I'm going to need some help because this is too much. And I thought to myself, like, I'm glad that she said that because it's important. I'm glad that she was that self-aware to know that she is going to need some sort of counseling.
Right.
From a psychiatrist or a psychologist. Are those one and the same?
The psychiatrist can prescribe medication. Psychologist is more so providing therapy. Then you also have your psych nurse practitioners, and you have your physician assistant.
Okay.
So, access has been a issue in the community as well.
Mm-hmm. In terms of for mental health.
For mental health. Most of the time, the wait times now are about maybe 3 to 6 months for new patient evaluations. So if an individual is scheduled an appointment 3 months out and something happened in the meantime, they're more likely to go to the hospital. So they're hospitalized, which is costing more money. Mm-hmm. It's taking them time away from their family, from their kids, and from work, which can spiral down. So it's better if individuals can seek help in the community. We have community mental health centers. We have outpatient private practices. So that's another thing that we want to talk about is accessing these services. How do you get help?
Mm-hmm. And, of course, is mental health, and some people may not know, is mental health covered through most health insurance?
It is covered through most health insurances, but unfortunately, there may be less coverage for mental health in comparison to some of the medical term benefits.
Now, that is so weird to me because how can your body continue to be right if your mind isn't right? Like it all starts from the head, right?
Exactly.
So if your mental health isn't intact, then how does one expect the rest of you to go along and be okay?
Exactly. It's all about awareness. It's just like a person with hypertension. If they don't take their blood pressure medication that day, they could possibly stroke out, right? Stroke out and die.
Right.
Mental health, for a person who is suicidal, if they stop taking their antidepressant, all of a sudden, what can happen? They can kill themselves. It's the same thing, the same endpoint. A person's not here anymore. So we need the same awareness for mental health that we give our physical health.
Yes, indeed. Where do people need to go to get more information on this? Because this is just vital and very important how, mental health affects us and how we shy away from it. We don't talk about it, know?
Yeah, definitely, KG. So to register for this event, just go to www.mentalhealth2017.eventbrite.com. This is a totally free event. We'll have door prizes we'll give away. We'll have refreshments that we're going to serve throughout the day. Also, if you want to call to register, you can call 832-895-9799. And once again, it's open to the general public, open to the entire city and the community. And we just want to bring awareness to mental health. We'll be able to evaluate mental health and help people provide ways to cope with symptoms.
Yeah, I'm seeing one on here with one of the sessions that is happening. Children's mental health issues. So very important. Kids go through a lot, and kids are growing up a lot faster these days than when I was growing up, and I thought that we were growing up fast. Right. Nothing compared to what is going on today. One of the things that kind of, and I'm not a conspiracy theorist, per se, but there has to be some sort of correlation, or it just seems to be very a big coincidence that most children nowadays, when born and going through getting their vaccines,
right,
how as they get older and develop and their brain develops more in their body parts, that they are being diagnosed with autism. And so it's just getting me to thinking, is there some sort of correlation between these vaccines that are being given to newborns or toddlers, and then later on they become autistic? Because, I mean, this wasn't really, going on in the 90s, maybe.
Mm-hmm.
Any thoughts on that?
That topic is starting to be discussed. I actually saw research on that maybe about 3 or 4 months ago that caught my attention. So I haven't seen anything
solid,
nothing solid saying that there is a definite link, but it is starting to be researched more. So hopefully within the next few years we'll know something.
And I asked that because I've heard story after story of how the child is fine, it's responsive, it's regular. They go back to get these vaccinations, and their child is a different human. And, not responding to their name, just seeming just somewhere else. And it's scary, right, to think. But if they're black, then again, I really wouldn't be surprised. I mean, they've been experimenting on us since we got over here.
That is true.
I mean, we can even go with it.
It is scary because the babies are getting, when they go in for, let's say, a 6-month appointment, they may get 5 vaccinations at one time. So some parents are concerned about a baby receiving that many vaccinations at one time, and why not spread it out?
Mm-hmm.
That's true.
So
nice. And bipolar and depression.
Mm-hmm.
The term bipolar is thrown around, and a lot of people play with it, but it is a real serious mental health issue.
Yes, it is.
And how much does that affect us in the black community?
It affects us in every community. In the black community, I've seen more so misdiagnosis of, let's say it's a male with the affective symptoms, so they're having mood issues, anger, aggression. They're misdiagnosed with schizophrenia often. And there's more research available on that as well. But as far as bipolar and depression, that affects us quite a bit. With something like bipolar disorder, once they get on medication, they have to stay on that medication for life. Yeah.
Didn't know that.
They do. They have to stay on the medication for life. So that's one thing with that. As far as depression is affecting men, women, children.
So common.
So common.
I went through it when I turned, maybe 2 summers ago. 2 summers ago, after my birthday, I don't know what was going on. I wasn't motivated. I didn't want to do anything. I didn't have a sex drive. I was worried. I was like, what is going on with me? And I was in this funk for my birthday's in July. I probably didn't get out of it till maybe mid-September. I didn't start feeling back regular.
Did you seek medical attention?
No, I didn't, because I didn't really know what it was until afterwards. And I'm explaining this to another doctor who I had on this same program. Okay. And they were saying oh yeah, you were dealing with some mild depression.
Yeah.
I was like, whoa.
Interesting.
It is very interesting. And you can get more information about mental health and mental health issues. They're going to, at this mental health symposium, they're going to have some sessions that covers a lot of things that we talked about today: children's mental health issues, Alzheimer's, dementia, bipolar, and depression. So much more mental health in the black community. So save the date for Saturday, this coming Saturday, November 18th, 11 a.m. to 2 p.m. at the University of Houston. Ron, give them that website again for more information?
Yes, indeed. So the website for more information and to register is www.mentalhealth2017.eventbrite.com, or you can also call and register at 832-895-9799.
And Dr. Kearney, where can people get more information on you and follow you? Because I mean, You've given us some great information this morning.
Yes. Well, I work with Barnes and Associates Psychiatry Practice. If you think, or if you yourself or you know someone that's needing professional help right now, please call us at our office, 713-521-5930. We have a therapist, a psychiatrist, and 2 nurse practitioners, and we are taking appointments right now, and we don't have a 3-month wait at this time. So please get the word out and refer people as you need to.
Oh, well, I think I'll take advantage just for the experience and maybe get some things out and maybe solve some, inner emotional problems or reasons why this isn't happening because maybe I'm this, that, and the third myself. No, I'm serious.
That's
because
good. Things we need to be aware of.
Yeah, right. I mean, yeah. I am not afraid to go to the doctor. Anything wrong, I'm there. But yes. Thank you all so much. Dr. Kelly Kinney and Ron Lockett, thank you so much.
Thank you very much. Thank you for having us.
Good Sunday morning. You're listening to Access Houston. I'm your host, KG Smooth. It's a lot of first-timers on this morning's program. welcoming from PPECF, the lovely Orjanel Lewis. Good morning.
Oh, good morning.
And representing 100 Black Men of Houston, Stephen Carter. Good morning,
Good morning. Good morning.
How are you all? Everything's good?
Doing well.
Outstanding.
Good stuff. So 100 Black Men of Houston putting on Real Men Who Cook. Yes. I remember the event from last year, and I had Kenneth up here, and we were talking about Real Men Who Cook. Stephen, can you tell us about what the event is about? I mean, it from the title, it's pretty self-explanatory, but give us the inspiration and the history behind having this particular event with 100 Black Men in Houston.
Excellent. Well, actually, I think Orjanel probably could tell a little bit more of the history, and then I'll piggyback on that.
Okay.
So this is an event that we actually did last year where we had guys come out and cook their very best dishes to be judged and win a trophy, a prize. This year, we decided to do it a little bit better, upgrade ourselves, and partner with the 100 Black Men of Metropolitan Houston. So we're very excited about that. This year, we're going to have so many aspects to make it a very family-friendly event.
Okay.
Not only will we have the chefs cooking, we'll have vendors, we'll have health screenings, we have events for the kids. Of course, we'll have the DJ playing. It's just going to be the best time ever.
Indeed. And what was the inspiration behind that?
But obviously we want to highlight the fact that we have real men who cook. I mean, and
like for real.
Yeah, for real. Like quite simply, in 2017, we, the meaning of what it is to be a man can be misconstrued and seen differently depending upon who's looking.
Depending on who's looking at in which generation you're talking to.
Which generation you're talking about, but there is nothing feminine at all about being able to cook. In fact, a lot of ladies appreciate the fact that they have a man who can cook and throw down in the kitchen.
That's right.
And do.
I've never, Stephen, school me. Women were thinking, or men, or people, period, thought that a man that cooked, there was something feminine about a man that cooked.
Just the fact that you find, hey, if a man wants a woman who can cook for him,
right?
But does the woman want a man that can cook for her? So really, when you think about the from a appealability, being appealing from the opposite sex, what's more important? You look at the woman being able to cook. But we got some guys that are going to be there Sunday. They can really throw down, and so it's going to be some phenomenal stuff. And they are very competitive about it as well.
Okay,
and they want bragging rights, and they want to be able to
They are making videos and everything. They are very competitive. It's more competitive this year than I've ever seen it before.
Yeah. Really? So it's happening today from 12 until 6 at the Buffalo Soldiers Museum. Right there on Caroline. There we go. Thank you.
From 2 to 6 today, yeah.
From 2 to 6 today. How did you all go about selecting the men that cook? And what is going to happen at the event? Do people show up and, they sample what these men have prepared? Or how does this work today?
So there's a competitive aspect to it, obviously. And a lot of the aspect of the competition is about who has the most interest in their food selection. We'll have different dishes, different categories. So they'll have anywhere from dessert to pasta to salad to
meats. Entrees to side dishes, appetizers. We have something for everybody. And as far as soliciting the men, PPECF, which is Phenomenal Pearls Educational and Charitable Foundation, is the fundraising arm of Chi Omicron Omega chapter of Alpha Kappa Alpha Sorority Incorporated. So a lot of these guys are our husbands, our friends, our beaux, wish we could have them as our beaux.
Your what if guy.
Right.
And, of course, guys of the 100 Black Men. We, of course, even have an amateur and professional aspect of it, too. So we have some professional caterers, guys that work in restaurants, out here making their best dishes. Crawfish bisque, ribs, brisket.
You're going to leave full. You're going to leave full. So every attendee who gets a ticket will have a number of tastings where you'll be able to go around and taste different samples from each one of the chefs, and be able to kind of give some feedback and let them know how they did. But at the same time, we have professional judges that will be there that will judge the food and will rank and at the end of the day, we're going to give our chefs an opportunity to highlight their dish at a local restaurant. We've partnered with Prospect Park, and we've partnered with The Roof. And both of those restaurants are going to allow those chefs to be able to have a dish of the day at their restaurant to highlight their special dish. So there's a lot that goes along with whoever's going to be the chef of the day. They'll have a dish of the day.
That's going to be nice.
Yeah.
You're listening to Access Houston. We're talking to Orjanel Lewis and Stephen Carter. 100 Black Men of Houston. They're having a Real Men Who Cook event today, 2 until 6 at the Buffalo Soldiers Museum. Stephen, we're always getting a slew of folks moving to Houston every week. I believe the last I read was there's about 1,000 people, a week that is moving down here to the H. So the secret is out.
Absolutely.
About our great city of Houston. So for those who may not know what 100 Black Men of Houston is or what they do, and there are other metropolitan cities that have 100 Black Men, maybe they heard it, but they just don't know what the mission is or what the organization does. Can you please explain to those who may not be familiar?
Great question, and I'd love to. So the 100 Black Men of Houston, let me talk about the organization, was founded in 1963 by a group of men who wanted to make a difference in their community, founded in New York. Since then, we've spread out all across the United States and even outside of the United States. There's 10,000 members, 10,000 plus members. Our mission is to make a difference in the community by way of mentoring young men of color. And so we have one of the most phenomenal mentoring programs for youth in all the cities that we're involved in. And there's 3 aspects to the 100. We have the Collegiate 100, which is our College 100 program, which in the Texas area, they have a chapter at Texas Southern, Prairie View, and University of Houston. And then after they graduate, there's an opportunity to go into what we call the Emerging 100, which is individuals that have expressed an interest in mentoring and are making a difference in their community between the ages of 21 and 35. And then after the age of 35, from 36 on, that is a part of the 100 Black Men of Metropolitan Houston, which is the larger organization, which is an organization that I'm a part of. But we base our organization on a number of pillars that are around financial literacy, education, mentoring, just basically trying to give our kids a well-rounded foundation to be successful.
Sure.
Our motto is what they see is what they'll be. So what we want to do is show an image of what you can be. And just to say real quick, we had an event a couple of weeks ago, Mentoring to Medicine, where we had 15 physicians of color come and talk to 250 plus young students of color about what it means to be a physician. Just yesterday, we had an event about the keeping our young men out of the criminal justice system.
Nice.
So that's the kind of stuff that we're doing just to make a difference for both the kids and their parents.
Indeed. And Orjanel, tell us about the acronym is PPECF, and it stands for
Phenomenal Pearls Educational and Charitable Foundation. It's actually the fundraising arm for Chi Omicron Omega chapter of Alpha Kappa Alpha Sorority. But we do all of the fundraising so that we can support, of course, scholarships in the communities. This year was our first year in giving out scholarships. We gave out $10,000 worth of scholarships to local area high school students to attend colleges all across the U.S. But we also support programs for the chapter like family strengthening, ending child hunger, global impact, environmental ownership, and, of course, a mentoring program, which we call Ascend.
Nice.
So this is exactly why we want to do this Real Men Who Cook event. Those funds that we raise, of course, will go to scholarships, and of course, will go to the programs of our respective organizations. But this year, we're adding the additional spin of working to support those who have been affected or devastated by Hurricane Harvey.
Indeed, and that is a challenge and something that we're going to be dealing with for a long time.
It really is.
Long time to recover. So I'm glad that you all are thinking about those Harvey victims as well as the kids, as well as everything else. You know, it's a tough act to balance.
It is.
But I'm glad that you all are stepping up and helping out, because people are going to need it for a long time. Hey, everybody, if you're not doing anything this afternoon, 2 p.m., Buffalo Soldiers Museum, 3816 Caroline Street. It is 100 Black Men of Houston's Real Men Who Cook. So come out and support and eat some good food, or sample some good food, rather, instead of eating. What else should the people know?
Just one other thing. If they are unable to attend, which, you know, life happens, so we get it, you can still make a donation, as both of our causes are extremely worthwhile. Donations can be made at 2017 menwhocook.eventbrite.com. And one more time, that's just 2017 menwhocook.eventbrite.com.
Indeed. And social media? Because you know that's where everybody is.
We are at PPECF on Facebook, Instagram, and Twitter.
Nice.
And we are at 100 Black Men Houston on Facebook, Twitter, all of those other social media platforms as well.
Indeed.
Yep.
Orjanel Lewis of PPECF and Stephen Carter of 100 Black Men of Houston. Thank you all for coming through.
Thank you for having us.
Thank you for the invitation.
And thank you for listening to Access Houston.